You have this entanglement at almost every level of medicine. And where it's most pernicious is at the level of the medical journals, which are at the top of the hierarchy. Medical journals are essentially the record of medical science. And even those journals are heavily dependent on drug company funding through advertising.
Scientific studies that are funded by industry are 5 times more likely to show a result that's favorable to drug companies than if the study was funded by an independent source like the National Institutes of Health.
The Eli Lilly Corporation, a pharmaceutical company, for nearly 15 years covered up their own internal investigation that showed that anyone on Prozac is 12 times more likely to attempt suicide than those using other antidepressants. Not 12 times more than the average population, 12 times more than those already on other antidepressants. This is a criminal act, and I want to know why these criminals are still walking the streets.
The United States makes up less than 5% of the world's population. But in terms of the world's total bill for prescription drugs, the US makes up about half of it. So the cost of drugs and the number of prescription drugs being consumed by Americans is just through the roof.
The pharmaceutical companies are making money hand over fist. The sicker we are, the more profit for their stockholders.
What we have today are pharmaceutical industry and the American Psychiatric Association taking normal human processes and labeling it as a disease, labeling it as a disorder, just so that they can sell a drug.
Just to give you an idea how ridiculous some of these mental illnesses are, one of the latest ones is post-election selection trauma. So if you happen to be politically inclined, you have to ensure you're not backing the wrong horse, because the symptoms include agitation, endless sulking, and bitterness. Psychiatrists have voted into existence, for example, palatophobia, which is the fear of bald people. We have novercophobia, which is a fear of mother-in-laws. Automatonophobia, which is the fear of ventriloquist dummies. And last year, they invented, believe it or not, with a show of hands, arachibutyrophobia, which is the fear of peanut butter sticking to the roof of your mouth.
Jefferson County 911. Yes, I am a teacher calling by high school. There is a student here with a gun.
Eric Harris was taking the antidepressant Luvox for a full year while he developed all his bizarre and violent fantasies.
In 3rd grade, I was put on Paxil. On Paxil, that made me hallucinate.
I set my alarm clock for 11 o'clock, and next thing I remember is waking up in the juvenile detention center in Ephrata, Washington.
What bothers me about this whole thing is that now we know that Corey was hallucinating on Paxil just a month after he went on them.
My husband and I attended a FDA hearing in Washington. The first hearing, there was 65 parents there. Their children had died while on antidepressants.
You know, just because it's easy to drug a kid and get them to be compliant doesn't make it right to do it.
And we're sort of coming to and asking my mother, you know, what day it was, and I was really surprised. It was like a week later than I thought it was. Whatever doctor it is has people from these companies visiting them and, you know, giving them things to prescribe you their drug.
I didn't feel anything.
Yeah.
I feel
kind of felt good, didn't it?
Is this real life?
Yeah, this is real life.
Okay, now I have 2 fingers.
Good.
No, 4 fingers.
4 fingers? No, don't put that in. Don't put it in your mouth. Okay. You feel good?
I can't see anything.
Yes, you can. Stay in your seat.
feel tired.
You don't?
I touch it.
Because it'll mess up the stitches.
You have 4 eyes.
Yeah.
I feel funny. Why is this happening to me?
It's okay, bud. It's just from the medicine. Okay?
Is this going to be forever?
Nee.
Is this going to be forever?
Nee.
Is this going to be forever?
New rule, if you believe you need to take all the pills the pharmaceutical industry says you do, then you're already on drugs. Because there is a point where even the most universal government health program can't help you. They can't outlaw unhealthy food or alcohol or cigarettes. 50 years ago, children didn't even get type 2 diabetes. Now, it's an emerging epidemic, as are a long list of ailments which used to be rare and have now been mainstreamed. If Republicans can sell the idea of preemptive war, Democrats have to at least get us interested in the idea of preventive medicine. Someone has to stand up and say that the answer isn't another pill. The answer is spinach.
The U.S. government allowed it to happen. The FDA allowed this to happen. And now the government is completely looking the other way. Thousands of innocent hemophiliacs have died from the AIDS virus. And not only they're dying, their family members are dying because they're becoming infected with the disease. This company knew absolutely that they had a problem with the product. They knew that it was infected with AIDS. They dumped it because they wanted to turn this disaster into a profit.
While its members have promised us peace, they have led us to war, heedless of the platform upon which they were elected. When hostilities commenced in Europe in 1939, it was realized by these groups that the American people had no intention of entering the war. They knew it would be worse than useless to ask us for a declaration of war at that time. But they believed that this country could be enticed into the war in very much the same way that it was enticed into the last one. They planned, first, to prepare the United States for foreign war under the guise of American defense. Second, to involve us in the war, step by step, without our realization. Third, to create a series of incidents which would force us into the actual conflict. These plans were, of course, to be covered and assisted by the full power of their propaganda. Our theaters soon became filled with plays portraying the glory of war. Newsreels lost all semblance of objectivity. Newspapers and magazines began to lose advertising if they carried anti-war articles. A smear campaign was instituted against individuals who opposed intervention. The terms fifth columnist, traitor, Nazi, anti-Semitic were thrown ceaselessly at anyone who dared to suggest that it was not to the best interests of the United States to enter war. Men lost their jobs if they were frankly anti-war. Many others dared no longer speak. Before long, lecture halls that were open to advocates of war were closed to speakers who opposed it. A fear campaign was inaugurated. We were told that aviation, which has held the British fleet off the continent of Europe, made America more vulnerable than ever before to invasion. Propaganda was in full swing. There was no difficulty in obtaining billions of dollars for arms under the guise of defending America. Our people stood united on a program for defense. Congress passed appropriation after appropriation for guns and planes and battleships with the approval of the overwhelming majority of our citizens. That a large portion of these appropriations was to be used to build arms for Europe, we did not learn until later. That was another step.
Is this going to be forever?